Casey. I'll be your student physical therapist today.
Hi.
How can I refer to you as?
Janie's fine.
Janie. Okay. So tell me, Janie, what brings you in today?
So I had a DVT removed.
Oh, wow.
In my left calf.
Okay.
Like 3 months ago,
Mm-hmm.
and like 2 weeks ago, I was like at the gym and I was walking on the treadmill, and my left ankle just started hurting.
Okay.
Yeah.
Do you remember doing anything to cause that pain, or was it just kind of out of nowhere?
It was just kind of like out of nowhere. The back of my calf has just always hurt though, so I feel like it's kind of like starting to go into my foot.
When you say it always hurts, is that even before the surgery or since the surgery that you had?
Since the surgery.
Okay. Is there anything that you've tried to do to make your pain better?
Just rest. I'm kind of afraid to like move it a lot because I don't want to give myself another DVT.
Yeah. Okay. Is there anything that's made it worse? That makes it worse?
Moving it a lot and like touching it, like when I go like this, it does hurt.
Okay. On a scale from 0 to 10, so 0 would be you have no pain, and 10 would be you need to go to the emergency room right now. What would you rate your pain at rest?
Like a 3.
3? Okay. What would you rate it when it's at its worst?
Like an 8.
8. Okay. All right. So, based on what you've told me, I'm going to summarize everything that you've told me so far. So you had surgery to remove your DVT about 3 months ago, and then about 2 weeks ago while you were walking on the treadmill, you just kind of got some calf pain out of nowhere, and ever since then, anything touching it or any excess movement seems to aggravate it and hurt and causes some pain. That sounds about right. Okay. So what I would like to do moving forward is kind of talk about some of that pain with you that you've been feeling, especially since there wasn't anything in particular to cause that pain that you felt 2 weeks ago and that started this pain. So I would like to talk to you about that and kind of get what your understanding is about your pain, and maybe give you a few tips and just talk about it to see if we can kind of level that out for you, if that's okay with you. And then I can give you an exercise for you to take home with you and hopefully resolve some of that calf pain. Okay. So what I would like for you to do is tell me what you know about pain. If there's anything that your doctors told you or anything that you've just kind of learned throughout this process you've gone through.
I mean, I know that when I hurt myself, then I feel pain. So that's what I know.
Yeah. So how I kind of want to explain it to you is since your surgery, so as with most surgeries, you do experience some tissue damage when they go in, make the incision, and remove what they need to remove. So then there are receptors in our body that we call nociceptors. I know that's a big scientific word, but those receptors can sometimes be mistaken as pain receptors. So a lot of the time they are used interchangeably, but they don't necessarily mean the same thing. So those receptors will take the signal of tissue damage and send that up to your brain, and then your brain makes the decision of whether or not you experience pain. So as a result of your surgery, that interpretation that was elicited was probably correct interpretation because you had an incision and then you had some tissue damage to your skin and to the muscle and things like that to get that DVT out. But now, since you've recovered from that surgery and that's not the source of the pain that you're feeling anymore, the area in your brain that interprets that signal from those receptors that I talked about is kind of blurred and is misshapen in your brain. So now your brain interprets any signal from that area as a painful signal, as a danger signal. So your body is setting off an alarm even if there's no threat. Does that make sense? Okay. So there are a couple things that we can do to resharpen or reshape those areas in your brain so that they don't elicit that painful response with the minor movement and minor things that you do that right now seem to be causing some of that pain. Okay, do you have any questions for me so far?
I don't think so.
Okay, so what I would like to do is teach you an exercise. But first, I want you to tell me if there's any movement in particular, anything that you do specifically that really just, elicits that pain.
I don't like to lift my heels off the floor when I'm standing.
Like go up on your tiptoes or anything?
Yeah, because one time I did that, and then I went to bed at night and my legs started cramping, and I thought I was having another DVT. So, and it just made the pain so much worse.
Yeah. I also wanted to mention to you, so what you're seeing me for, and kind of that, the muscles in the back of the leg and that I'm helping kind of get back to your regular motion with, won't necessarily cause that DVT again, okay? I just wanted to make that clear for you before we move forward. So any of the motions that we do here won't per se cause a DVT. If you do have any of those symptoms that you felt the last time when you did experience a DVT, make sure you call your doctor right away, okay? And then let me know if you do feel those same symptoms, and we will get that taken care of, okay? So the exercise that I want to teach you, so it's kind of a form of a calf raise. So you're not going up on your tiptoes, you're not putting weight on your toes or anything, but this is still that same kind of motion. So I think I want to start with this. And then we can progress to getting up on your toes little by little as you feel comfortable, okay? So I want you to go ahead and scoot this way and then swing your legs up onto the table if you can. And then I want you to let me know if any of this causes the same pain or if it's a pain that you can't tolerate. So if it's painful that you can tolerate, I want you to be able to keep going, but if it's to where you can't tolerate it, let me know and we'll stop. Okay? So what I want you to do is take this band at both ends. Okay. So I'm going to put this down here on your toes, and I want you to pull this band as tight as you can. Okay? So now what I want you to do is to pull your toes back, and then I want you to push against this band like you're pushing on a gas pedal. And then relax. How does that feel?
Feels okay.
Feels okay?
Yeah.
Okay, so I want you to go ahead and do as many as you can.
Until I start to get tired? Or...
Yeah, I think until you start to get tired, or if any of those symptoms, like I said before, if those return, let me know, but we're going to work towards until you get tired.
I'm not sure how many I've done.
Okay, I think you've done about 5.
Okay.
So that was 6, 7, 8, 9, 10.
Okay, I don't think I can do anymore.
What kind of feeling are you having right now in your calf?
Just kind of weak.
Okay.
Tired.
Okay. So I think this exercise, while it is going to help sharpen those areas in your brain that we talked about earlier, I think this is a good strengthening exercise for your calf as well. So while we're here, we're going to do 2 more sets. So you would do 3 sets of 10. I'm going to send you home with the TheraBand as well. And you'll do this every other day. So you can do it Tuesday, Thursday, Saturday, Monday, Wednesday, Friday, whatever works in your schedule. Just 3 sets of 10, morning or night, whatever's better for you. Okay? So, do you have any questions for me?
No, I don't.
Okay, well, if you have any questions next time, if you think of anything while you're at home, just bring it with you next time when you come to your appointment next week, and we will get those answered for you.
Okay, thank you.
Nice to meet you.
Nice to meet you.